The research has been clear. Substances known as PFAS, or forever chemicals, present a serious health risk. Now, for the first time, the U.S. Environmental Protection Agency is placing strict limits on PFAS in drinking water. Sydney Evans is a safety expert.
Some of the things that have been linked early on, there were links to different kinds of cancers, like testicular cancer. But more recently, there's been links to things like increased cholesterol. And one of the more concerning ones is impacts on the immune system. So there have been studies showing that some vaccines are less effective in kids that had higher concentrations of PFAS in their blood.
Forever chemicals date back to the 1940s and are used in manufacturing common items like clothing, nonstick cookware, and furniture. They do not break down in the environment and can build up in drinking water sources. Several major chemical companies have paid billions of dollars to settle lawsuits over PFAS contamination. Trade groups representing the chemical industry have fought the new regulations.
Biggest barriers to the progress here have been the lobbying by some of the companies, right? These chemicals are making them a lot of money. They're in a lot of products. There's this power dynamic, right, between the industries that have these resources and have made this money and have all of these ways in which they can defend their bottom line versus the resources of the people and therefore the government to prove otherwise.
Under the new rule, public water systems have 3 years to monitor PFAS levels and report to the public, and 5 years to bring the forever chemicals down to acceptable levels. Experts say those concerned about the risk now can take steps to protect their home water supply.
It's well known that reverse osmosis systems can reduce or completely remove PFAS from drinking water. The home filter can be good enough, at least in the short term, for the couple of years while we're trying to fix this environmental situation, to protect people at home.
The EPA estimates the new rules will protect 100 million people and potentially prevent thousands of deaths and tens of thousands of serious illnesses. Jim Spellman, CGTN, Washington.